First of all, what options do I have if I have Parkinson's disease to see a medical professional?
Before you have a diagnosis made, you'll probably want to seek out your GP to discuss the symptoms that are concerning you. And an astute GP may pick up some symptoms or signs that are typical of Parkinson's and should refer you to someone who's a specialist in Parkinson's. And most Parkinson's specialists are either neurologists or their care of the elderly physicians who have a special interest in Parkinson's.
And how often can I expect to visit my neurologist or specialist?
I think that everybody should be seen at least every 6 months. That's what NICE recommends, that there is a review by a Parkinson's specialist every 6 months. Whenever I see someone in clinic, I write down that they should come back and see me in 6 months. There's often a capacity issue. We try and see people as close as possible to every 6 months, bearing in mind that there'll be some unforeseen urgent things that arise, and you might need to get someone to come and see you sooner than that. And so there has to be a bit of flexibility in the follow-up appointments. But 6 months is the right ballpark.
So if I have a problem in between my 6 monthly appointments, then I should call my specialist?
So on outpatient letters, there should be a contact detail either for the phone number for the secretary of the consultant you're seeing, or an email address, or there may be a team where there's a nurse who's the first point of contact, and they can escalate to the specialist, whether it's the neurologist or the care of the elderly physician, as appropriate.
So you mentioned a nurse. So in the UK, we have Parkinson's nurses, and I think in some other countries as well. Can you explain the difference between what the neurologist does and what the Parkinson's nurse does?
So both should be experts at Parkinson's disease. The doctor, of course, will have a medical training about all the other conditions that can affect people, because Parkinson's is never a standalone illness. People can get arthritis, they can get back pain, they can get headaches, they can get cardiovascular disease. And so the neurologist, the specialist, needs to be able to interpret what the symptoms of Parkinson's are in the context of every other illness or problem that someone may pose. Whereas the nurse, may have a little bit more holistic view on how Parkinson's affects people in their day-to-day life, their personal situation, their jobs, their relationships. And so there's a different perspective of how to give people the best advice. And so having the two is a very good complementary way of setting up a service.
So if I have an appointment with my neurologist, what sort of things should I prepare to discuss at that appointment? What sort of questions might I ask?
So it's really important to make sure that you can feedback exactly what medications you're taking. If something is going well or something's going badly, how that relates to medication timing, medication dose, compliance with medication, and the side effects. I think having a list of drugs and perhaps the three biggest issues, whether they're problems or whether they're just questions, on a single sheet of paper. If you've got medications, doses, the three biggest issues of the day, all on a single sheet, then there should be time to go through all of those in adequate detail, do any examination, and then decide what the actions are going to be. And if there are more than three issues, then the later ones maybe save for the next appointment.
And is there anything that's perhaps not appropriate to discuss with a neurologist and perhaps better to discuss with a Parkinson's nurse?
I don't think there's a clear boundary. If there's something that's on someone's mind, even if it's got nothing to do with Parkinson's, there should be free rein to bring up what is important. And if there is a line crossed, then the specialist should be able to say, this isn't the right place, or I don't have the right knowledge or expertise to tell you about that. Sometimes the most personal problems, about sexual relationships, impotence, erectile dysfunction, all these things are on people's minds, and they don't know if they're drug side effects or if they're common in Parkinson's, and the most personal things might actually be really relevant. Everything should be discussed if it's on a person's mind, and the specialist should be the person to feedback on if that's the best forum or not.
It's generally recommended to see a Parkinson's specialist every 6 months. However, there may occasionally be a requirement to make appointments more often. When preparing for an appointment, record the drugs and doses you're on and choose 3 key points to raise with your specialist. When talking to someone in your Parkinson's team, no subject should be off the table. If it's on your mind, it's open for conversation.